We actually had our last set of guidelines were from 2003, so it was well past time, 20 years later, that we finally updated the postpartum guidelines. So the 2024 Canadian Guideline for Physical Activity, Sleep, and Sedentary Behavior in the first year postpartum is actually a transition guideline between the guidelines for physical activity during pregnancy and the 24-hour guidelines for adults. We recommend slowly and gradually building towards 120 minutes of moderate to vigorous physical activity spread over 4 or more days of the week. Now, much of this will begin with gentle walking and building in the volume and intensity of activity over the course of the first year postpartum. We do recommend incorporating, as symptoms allow you to progress, to start to engage in resistance training in the postpartum period as well. We do recommend beginning early in the postpartum period, so definitely in the first 12 weeks postpartum, to help support your mental health. So we have extensive data now which is demonstrating that early return to activity in the postpartum period will help to reduce the symptoms of depression and even the prevalence of depression in the postpartum period. The postpartum period is really rapid change in your life circumstances, and so sometimes it can present these really unique obstacles that can make following the guideline quite challenging. It's really important that if you are finding it challenging to meet the current recommendations, that you want to find and get robust emotional and social support from your partners, family, and society to be able to really help you to effectively progress towards the recommended guidelines. We also really recommend in the postpartum period to engage in pelvic floor muscle training on a daily basis to be able to reduce the risk of urinary incontinence and to actually rehabilitate your pelvic floor muscles that may have been under or impacted by pregnancy, labor, and delivery. So while pregnancy and postpartum period can be a really wonderful time in a person's life, we know that up to 20 to 25% of all women in the early postpartum period will experience some level of anxiety, depression, and depressive symptoms. While it's very common, there's lots of things that need to be or that can be done to help support mental health. And physical activity is an important component. We know that engaging in physical activity early in the postpartum period can help to reduce the risk of developing depression, but it can also to increase or improve depressive symptoms as well. We also know that urinary incontinence is quite common in the postpartum period. If you had it during pregnancy, you're more likely to experience it in the postpartum period. Engaging in pelvic floor muscle training is really important, ideally with the support of a pelvic floor specialist. Sleep in the postpartum period can be exceptionally challenging. However, data suggests that if you can utilize different strategies to be able to help improve your sleep hygiene, so avoiding screens before bedtime, creating a darkened and quiet sleeping environment, you may be able to enhance your overall sleep quality and as a result help to support your mental health. However, it's really important that you prioritize self-care without feeling guilty if certain strategies to achieve the recommendations within the guideline don't allow with your current circumstances. During pregnancy, as the baby in the uterus is growing, you are going to start to get a stretching of the rectus abdominis muscles. So those are two muscles that go vertically along your abdomen. Between the two, you have this tissue that will actually stretch during your pregnancy. It's normal, it's expected, it's an adaptation that helps to support the growing baby. In the postpartum period, what we're seeing is that a large proportion of people will continue to experience diastasis rectus abdominis. However, what we're finding is that for many people, this is not going to impact their daily lives. There's certainly rehabilitation that you can do to strengthen your abdominal wall, but it's more cosmetic and not going to impact your ability to return to activity. It's really important and healthful to gain a recommended amount of weight during your pregnancy. And there's guidelines based on your pre-pregnancy body weight in terms of how much is recommended for your individual circumstance. However, we know that weight is gained over 9 months of pregnancy, and so typically the weight will take at least that long to come off in the postpartum period. Now, our data suggests that physical activity can play an important role, but it's probably not the most important aspect of helping to reduce weight in the postpartum period. Focusing on a combination of increasing your physical activity, but also focusing on a healthful diet can be important to help you get back to your pre-pregnancy weight.